Great. So the next thing I'll ask is, what are the political issues that are most important to you in this presidential cycle?
Well, I think one of the key issues that we're having to deal with in my hospital is the staffing levels. We have far too many patients for the nurses that are having to care for them. The workload is incredible. It makes it difficult to keep nurses because they just don't. Nurses want to feel like they're accomplishing something. And when you have to go through your day and you have to prioritize who's going to get the care, and you're leaving some patients out because you don't have enough time to do it, it's hard to feel good about the job that you're doing. And so staffing is one of the key issues for me. And also healthcare. I just feel that it's a right, not a privilege, for people in the United States to have healthcare. Why should we be paying so much for our health care and not getting the benefit of everybody being able to benefit from that?
My main issue is the universal health care. We've got to have universal health care in this nation. Personally, in my family, I work full-time. I pay $600 a month for my health care benefits. It covers myself and my 2 boys. My husband, who is unemployed, is not covered. If something catastrophic happened to him, I don't even think about it. So we've got to have universal health care.
I also really feel strongly about these two issues. In terms of coverage for everybody, we have 47 million people in this country who do not have health care, and the number is growing. It has grown significantly over the last 4 years. We see employers, as the cost rises, decreasing coverage or eliminating coverage completely for employees. We have an employment-based healthcare system, yet it's not working. So we need a major change. We need a system that doesn't just provide sick care. We need a system that provides preventative care as a way to help control costs, and we need a system that ensures quality, not expensive care that can be inefficient or not needed. So I think there's a movement now. Lots more people are talking about changing our healthcare system, and this upcoming election in '08 for president and also for Congress and state races is critical to electing people who will make healthcare a priority. So I would say in that sense I'm a healthcare voter, and I'm also want to not just cast my ballot on election day, but I want to help get the candidates who support the changes we want in office. I think nursing is, as kind of frontline care providers, we know that if we don't have enough nurses taking care of patients, the care is going to suffer. And the burden of mistakes, safety issues, then is borne on the backs of nurses. We need major change in this country to keep nurses from leaving hospital nursing because it's too stressful, too hard, and dangerous. We need to attract younger people to nursing who see it as a great career, and to do so we need to change public policy on workloads for nurses to ensure safety for nurses and patients.
Okay, thank you. Do you find it, as nurses, do you find it rewarding to be active in the political process?
Actually, it's very empowering to be part of that political process. To know that, when I go to speak with a representative and I say I'm a nurse, that their ears kind of perk up and they actually stop and listen to what I have to say, because I'm speaking from the front line, I'm speaking from experience. And nursing is one of these caring professions where the representatives understand that that's a caring profession. So I'm not speaking just for myself. I'm also speaking for the people that I'm working for, the patients that I'm taking care of, and trying to make sure that they get the best care that they're gonna possibly get.
Okay. Thank you.
I feel the same way. It's empowering a lot of times. Well, Diane was talking. I'm sorry, my mind kind of wandered, but I thought about the universal health care and how in my job itself I'm affected by that daily. My job is case manager, insurance case manager at a home health agency. So it's my job to make sure that we're going to get paid. Our agency is going to get paid. And I talk to 30 people every week in my little community of Olympia, Washington, who don't have health insurance. They have a doctor's order for home health, but they have absolutely no way to pay for it. So it's my job to help them get that. And that would be resolved with universal health care.
What's the question again?
Sorry.
I'm asking you if you find it rewarding as a nurse to be active in the political process.
I think it's not only rewarding, it's imperative. I think there's only so much we can do by speaking out and being united in our workplaces to advocate for change. I think there's a number of changes that are needed that are bigger than individual employers can provide. That doesn't mean that individual employers should be off the hook for ensuring that patients get safe, competent care, but we need changes that are bigger than individual employers, and being involved in the political process enables that to happen.